Good morning, good morning. Happy Wednesday. It's sedation day today. As you can see, the girls have already set up the room for sedation. We have a full busy day. Up in here since 5:30, it's 6:30 now. I usually come in 2-3 hours before everyone else to just go over my schedule, look at my cases, see the final result in my mind's eye, and mentally prepare myself for the day. All my favorite equipment are moved to this room now. My Ultraman Pro, ultrasonic unit, light, apex. First case we'll be working on is this tooth number 30. The crown, according to the patient, is about 10 years old. Recently, tooth started to hurt to hot, cold, and biting. Chewing on the tooth. Tooth hurts so much that patient says that she can't even touch it with her finger. When I examined the tooth, it was very, very tender. Painful to percussion. Palpation was within normal limits. Probings were 2 to 4 millimeters all around. So when the patient says tooth hurts to hot and cold, and I don't usually test for hot and cold if I find the tooth to be percussion tender. So I test all the other teeth on the lower right side and upper right side. I percuss them, and if there's just one tooth that's percussion sensitive, then I don't do the cold set. Why make the patient suffer any more than she already has by doing a vitality test? So I percuss number 28, number 29, number 31, and I leave the tooth in question last. Then I also test the upper right teeth because sometimes, you have referred pain. So tooth number 2, tooth number 3, tooth number 4, tooth number 5. If they're all testing within normal limit to percussion, then I go to the tooth in question, and then I percuss that tooth. And when the patient raises his or her hand telling me that the tooth hurts, or sometimes I apply digital pressure, just finger pressure, and patient jumps out of the chair, then I don't need to do vitality. The next patient, we're doing 2 root canals, number 29 and number 30. As you can see, number 29 has a periapical lucency. Patient has symptoms. This was an interesting case. So I look at the teeth. Patient is here for tooth number 29 only. So the dentist referred the patient to me for tooth number 29. Then I asked the patient, of course, this is like clear, periapical lucency, percussion tender, palpation tender, probing is 2 to 3 millimeters. So that's the root canal crown there. And I asked the patient, I say, you have a cavity under your crown, your old crown. What's the plan for this tooth? And patient says, my dentist is going to pull it. My dentist recommended that I should pull it and then get a dental implant. I'm like, what? What? As much as I don't like to override my referring doctor, referring dentist, I sometimes have to. I need to interfere because patient's well-being comes first. For me, patient's well-being comes first. Maintaining a patient's natural dentition, to me, is my number one priority. I don't do anything other than thinking about what's best for my patient. And here I told the patient, I said, please, I beg you, I'm begging you, reconsider. This tooth can be saved. It's got really nice roots. Look at it. Look, it would be a shame. It would be a crime to pull this tooth. So patient said, I would love to keep my own tooth. I was shocked when my dentist told me that he wanted to pull it. So that's what we're going to do also. So we're going to do number 29 and we're going to do 30. And we save teeth that are in worse shape than this. This is nothing. It's just, I'll go through the crown, clean out the decay, rebuild the missing walls, and do the root canal. Then the patient goes back to, of course, tooth number 29. So patient goes back to his dentist. The dentist will cut the crown off, rebuild the tooth, and put a new crown on there. We save teeth that are in 10 times worse shape than this. So why pull this tooth? Anyways, so I'm glad the patient agreed. I already wrote a report to the dentist. I didn't get any callback from the dentist, so I'm sure the dentist is agreeing with my recommendation. So that's the second patient. And this is the next treatment, not tooth number 14, but tooth number 15. Tooth number 14, the root canal, if you can call this a root canal. This root canal was done over 10 years ago, and the tooth has never hurt, never bothered the patient. Dr. Lin, rest in peace, brother. I love you. But you can see that the dentist who did this root canal did such a terrible root canal. Or should I call this a terrible root canal? Because this patient has had no symptoms in the past 10 years associated with tooth number 14. The dentist could not make the curvature here. You can see the canal curvature here. Look how short the fill is in the distal buccal. Look how short the fill is in the palatal canal. No symptoms, no issues, no periapical relucencies. Tooth is in full function. Take a look here, another angulation. So this dentist, and most importantly, the patient got lucky with this kind of root canal, and no symptoms, no issues associated with the tooth. So we're not gonna redo this root canal just because we don't like the way it looks on the X-ray. The patient needs a root canal, tooth number 15, the second molar, and tooth hurts to hot and cold and biting. So irreversible pulpitis with acute apical periodontitis.